So welcome back to my YouTube channel. Welcome back to nursing channel. We are continuing with our content. So if you are new here and you have not subscribed, kindly subscribe. If you are a returning subscriber, thank you very much for always clicking in. So today we want to talk about IV fluid, intravenous fluids. So we have different types of intravenous fluid, and different types of intravenous fluid are given according to the condition of the patient, and maybe when the patient is maybe before surgery or during surgery, and we are going to see the reason why certain intravenous fluid can be administered to a certain patient. So IV fluids are, IV fluids are specifically formulated liquid that are injected into a vein to prevent or to treat dehydration. They are used in people of all ages who are sick, injured, dehydrated from exercise or heat, or people who are undergoing surgery. Intravenous rehydration is simple and safe and common procedure with low risk complication. What do I mean by that? I mean it doesn't have any complication. If you have any risk, are low or even they are not there. So we have said IV fluids are liquids injected into a person's vein through intravenous tube. They prevent or treat dehydration and electrolyte imbalance. So electrolyte imbalance and dehydration, especially when you vomit, they can come in when you vomit, when you diarrhea, when you have maybe a cut wound and it is bleeding, is when you can get those those electrolyte imbalance and dehydration. So why are intravenous fluid used? Why are intravenous fluid used? Let's say water is essential to every cell in our body. Yeah, for your body to function normally, you have all cells in the body, and these cells, they need water. In fact, our bodies are made up of about 60% of water. So when you don't have enough water in your body, that is called dehydration. Yeah, when you don't have enough cells in your body, enough water in your body, sorry, it is called dehydration. So a person may need IV fluid when they become dehydrated. So serious dehydration may occur when you vomit, diarrhea, when you have extreme or intense exercise, when you have a serious injury or burns, or when you have a surgery, especially when you are asleep for a long time, or you are unable to eat or drink for a long period of time. Yeah, those are the time somebody might need IV fluids. So what are the effects of dehydration? What are the effects of dehydration? We have said that our body needs water for it to function normally. So what are the effects when your body doesn't have water? You will get electrolyte imbalance, and you know this electrolyte imbalance are also important in our body. Cognitive impairment, that is another problem that will set in. We have low energy. You will be a person who is weak, or fatigue will set in, and also your body will not function normally. Your skin will be dry, scaly, wrinkled. You will not have a healthy skin. Physical performance will be poor. Your organs such as kidney, heart, and brain may fail if you have dehydration. So how do we know that somebody is having dehydration? How, if you are a healthcare provider, how will you assess? How will you tell that these your patients need IV fluids, these your patients need to be rehydrated? So most of the time, those people who are dehydrated, they will present with dizziness, they will present with the dry eyes, or maybe if he or she is a child, when he or she cries, there will be no tears, there will be dry lips, the skin will be wrinkled, or the skin will be wrinkled and dry, fatigue will set in, fast breathing will set in, hands and feet may also be cold to touch. When you touch somebody who is dehydrated, you will find that the hands, the feet are very cold. This person can excrete dark urine with a strong smell. So if you go to urinate and you find that your urine is smelling, I know I'm not saying smelling bad, but it has some odor, just know, and it is dark yellow, you just know that you are dehydrated and you need to take some water. So what are the types of IV fluids? There are different types of IV fluid. Your healthcare provider will decide which type is right for you, depending on how you need them. Yeah, depending on how you need them. So in short, we have two different types, two types of IV fluid. We have crystalloids and we have colloids. So crystalloid is where we have hypotonic, isotonic, and hypertonic. So these are crystalloid solutions are these are most common type of IV fluid. They contain small dissolving molecules that pass easily into the bloodstream, into the tissues, into the cells. Examples, they include normal saline, which is salt in normal saline, which is salt in water. We also have ringas lactate, and we have dextrose. So under crystalloid, we have three. We have the hypotonic, isotonic, and hypertonic. And all this, we have dextrose. Dextrose is hypertonic. Ringas lactate is isotonic, and normal saline is hypertonic. Yeah, I think I'm right. But what I really know about crystalloid, we have isotonic, hypotonic, and hypertonic. And this we have, and on these types we have the dextrose, the ringas lactate, and the normal saline. Those are the most common types of crystalloids that we have. And all these IV fluids, they contain potassium. Those crystalloids, they also contain potassium, sodium chloride. We have the calcium and the lactate. It is used, most of them are used in aggressive IV fluid replacement. So let's talk about colloids. These are large molecules that cannot easily pass through cell membrane and more likely to stay in the bloodstream for a longer period of time. And examples of them are albumin and hesitage. Yeah, and hesitage. So what happened during rehydration with IV fluids? If you need IV fluids, a healthcare provider will decide the type of IV fluid you need. It will determine the amount, or he or she will determine the amount of fluids you need and how quickly the IV fluid should flow. Or this is based on many factors, which include the weight, the age, and the medical condition. Yeah. So, and also another thing that so yeah, those are the things that will take place, or the healthcare will decide before they administer IV fluid. So another thing that I want to talk about, what will happen after IV fluid. After IV fluid can make you feel better very quickly, but your healthcare provider will determine when you can stop receiving intravenous fluid. So it is not your choice to decide when to stop taking IV fluid. It is the doctor, the nurse, who will determine, or who will decide that now you have gotten enough and your condition has resolved, so they can stop it. So what are the advantages and risk of this procedure? IV dehydration is common, simple, and safe. Remember that one I said when I was starting this video. and it doesn't have any complication. But there are some rare complications that might set in during the administration, like air embolism. An embolism. If you're a healthcare provider, mostly I'm talking to healthcare providers or the student nurses or the student medical health practitioner. So they already know what is called air embolism. But if you don't know, you can comment in the comment section so that I know. I explain it there. So air embolism or gas embolism can happen, and it occurs when IV fluid passes too much air into the vein, but it is rare but can occur. But it is a serious consequence that can cause death. So take care when you are administering IV fluids. We have vein collapse. Sometimes the veins can collapse when the needle is inserted or when IV fluid is in place for a long period of time. That is why they usually say that the best, if you are administering drugs through the vein or the IV fluid, make sure that the needle stay there for not more than 2 days. For not more than 2 days, that is 48 hours. After 2 days, you should remove that needle and replace it, because even if it doesn't collapse when you are giving you are in administering the IV fluids or you are giving the drugs, it can bring sepsis. Yeah, it can bring sepsis. It can bring a lot of complication on that side. So we have vein collapse that can take place. So this if this happen, your healthcare provider will try to find another vein to use. So it is serious, but we have a solution afterward. So we can also have a fluid overload if the healthcare provider did not calculate well or did not know the certain amount of fluid that you should get. We can get fluid overload, and this also the patient can represent with headache, high blood pressure, and maybe trouble in breathing. This usually resolves quickly with adjustment to fluid level, but it can be dangerous. Yeah, it can be dangerous. So we can also have hematoma. A hematoma can occur when blood leak from the blood vein into the nearby tissue. It can look like a bad bruise and usually goes away in a few weeks, but it can happen. Another thing is infection. If the area is not clean when the needle is inserted, infection may occur. Your healthcare provider can usually treat infection with antibiotics, but it can occur. There is another thing that can also occur, and that is infiltration. If the needle moves or get dislodged, fluid can enter into the tissue around the vein, and this may cause a stinging and bruising, but it's typically easy to resolve. Sometimes some of them, they usually develop into sepsis. Is it sepsis or how do you call it? Septicemia. Yeah, it can develop into septicemia but septicemia is treatable, so don't worry. We have also phlebitis. Phlebitis occur when the vein becomes swollen because of the IV fluid. Yeah, it is just inflammation of the vein because you prick the vein and sometimes it can inflame. Yeah, those are some of the complications that might set in when you are doing what? When somebody is administering IV fluid. So I think we are almost at the end. Yeah, we are almost at the end, but I think I've exhausted it. Yeah, I've exhausted it. When you feel those complications or when you notice them, tell your healthcare provider about it so that they can do something about it before it complicates it complicates. Yeah, before it complicates. So I think I've reached the end of this video. So if you've not subscribed, kindly subscribe. Why are you not subscribing, by the way? Why are you not watching my video? Anyway, subscribe, like, share, comment. Let's meet in the next video. If you want me to talk about something else, I will consider that if you comment in the comment section. So bye till next time.